You caught up with the doctor who diagnosed that patient way back in 2020. What does she think, though, about the future of COVID?
Hey, David, Dr. Katie Sharff says it's part of our lives now. It will be one of the respiratory viral illnesses that will always circulate. But the good news, deaths from the virus are down, and we saw major medical advances throughout this pandemic.
Masking, social distancing, and panic. This is what life was like back in the winter of 2020. On February 28th of that year, the first person was diagnosed with COVID-19 in Oregon by Dr. Katie Sharff with Kaiser Permanente. She says it was very surprising.
You know, the first patient was the engineer at my child's school. And so when I first diagnosed him, I was there really to deliver a greeting card. And things just didn't add up. It didn't make sense.
Throughout the next 2 years, society dealt with lockdowns, school closures, deaths, and strains on the healthcare system. Dr. Sharff says the pandemic caused a lot of anxiety for herself.
Just feeling constantly behind in trying to understand the disease and make the best choices for our patients and the community at large.
Dr. Sharff says the healthcare system has come a long way when it comes to treating COVID-19. At first, testing was not widely available. That soon changed with huge testing sites and then at-home tests. Then vaccines hit the market, which saved a lot of lives.
The All for Oregon mass vaccination site at the convention center, I mean, that was unprecedented. And I think we should really celebrate that amount of work and effort that provided protection to thousands, hundreds of thousands of Oregonians.
Dr. Sharff says hospitalizations have plateaued around 250 a day statewide. Deaths are also down, which speaks to population-level immunity and better treatments like antiviral therapies. When it comes to the future of COVID-19, Dr. Sharff says it's not going away anytime soon.
It's going to be one of the respiratory viral illnesses that we see circulating. And so I think trying to avoid COVID at all costs is probably not a practical way to exist moving forward.
And Dr. Sharff says the first COVID patient is doing well now as far as she knows. And when it comes to social distancing and widespread masking coming back, she doesn't think that will ever happen again.